Reports from the World Health Organization, Prof, are saying that there's nothing to worry about as yet. They did request information from China when this became public knowledge. They've received that data. What does that data say?
What it shows is that indicates is that the infections are relatively common viral and bacterial infections, some of which do affect children more, which are in general circulation all the time. And what happened was the very heavy lockdown in China, and effectively meant that there was a period in which people had no infections at all, and this kind of builds up an immunity gap, which then catches up when you start to, get back to normal. So there is always a consideration that that the sort of lockdowns and separations, etc., can result in it can actually result in a surge in infections later. Your immunity levels of protection are actually diminished through not being constantly infected.
The surge in, respiratory-related illnesses doesn't seem to be exclusive to China. I believe in the United States, for example, there last winter, there was a surge in respiratory illnesses, specifically in children, flus, influenzas, etc. Does that point to exactly what you are explaining right now?
Yeah, I think it's just the normalization. So we have a sort of a general level of protection. Being constantly infected actually helps our immune system. So any break in that, you think it's actually protecting you, but in fact what it's doing is making you more vulnerable to severe infection down the line.